This is my only patient. Based on the dispatch information and the disposition of the patient, this appears to be a nature of illness. I'm going to activate ALS because of the chief complaint, and we are in a public place, but there doesn't seem to be any signs of trauma, so I'm going to rule out C-spine at this time. So my general impression of the patient appeared to have a 24-year-old female, appears unstable and obvious distress. She's itching and having some difficulty breathing. Just one little footnote. So in reality, if someone is having difficulty breathing, we're not going to ask them a plethora of questions and like exacerbate the problem. However, the skills are written in such a way so we have to get a history before we can administer medications. Okay, so keep that in mind. You're probably not going to see, if you like drive by and see an ambulance and someone's having respiratory distress, you're not going to see someone get a huge long history before we treat it. Does that make sense? Mm-hmm. But the reason we do it this way, we want you guys to understand the concept behind what you're doing. So you have to get the history first. So keep that in mind. Okay, resume scene. Where was I?
General question.
Okay, so I'm going to introduce myself. Hi, my name is Jeff. I'm an EMT. I'm here to help you. What's your name?
Kristen.
Hello, Kristen. What? Can you tell me what city you were in?
San Diego.
And what year is it?
2015.
Okay, so I've determined my patient is ANO times 3. And why did you call us out today, Kristen?
I got stung by a bee.
Okay, and my patient chief complaint is bee sting. Or well, difficulty breathing is my patient chief complaint. So chief complaint, we'll get into that later. I'm sorry. So I'm going to ask my proctor at this point, do I notice any obvious life threats? And like I said earlier, if the patient was stung by a bee, that despite the bee separating, the stinger still being in the patient, is continuing to pump venom into the patient, okay? So that can be, conceivably, we don't want to continue our assessment without things continuously pumping toxic stuff into our patient. So at this point, in the life threats scenario, I would locate the stinger and remove it, okay? And again, we don't pinch or we don't get tweezers and pull out the stinger, because there's a little sac on the end of it, and that can inject more of the venom into the patient. So we scrape it with a credit card, or we can flick it if we see it. So, proctor, I'm assessing for any obvious life threats. What do I see?
You see a bee stinger in the right proximal claw.
Okay, so I'm going to take my protocol book and just brush that away. Is the life threat removed?
You removed the stinger successfully.
Okay. So I've determined my patient's airway is patent because she is speaking to me. She is having some obvious difficulty breathing. Is her breathing adequate? For rate or tidal volume?
Her normal tidal volume with labored respiration.
Okay, and I'm going to get a pulse oximetry.
She's 88% on there.
88%. So that's below 90%. We want to intervene with oxygen, high flow O2 with a non-rebreather mask. Okay, Kristen, I'm going to give you some oxygen. I'm going to put this mask on you. It's going to help you breathe a little bit easier. Just breathe as you normally would, okay? Put that on her. So now I'm going to go on to circulation. I'm going to get a pulse. What do I find?
Strong, rapid radial pulse.
Strong and rapid at the radial, okay. Also, another side note, we're not getting a rate up here. This is just the breathing. Again, we don't want to rate. We just want to see if she's breathing and is it adequate and do we need to intervene in any way. Same with the pulse. We're not getting a rate. We don't want to sit here for 30 seconds and get a rate. We just want to see really quickly, does she have one? And really, is it rapid? Is it slow? Is it strong? Is it weak? So we have a pulse. I'm going to do a quick visual blood sweep.
No visual blood.
Okay, and I'm going to assess skin color temperature condition.
Flushed, warm, dry skins with hives noted on arms and neck.
Okay, copy that. And I can get a cap refill as well.
Cap refill is less than 3.
Okay, so for this patient, based on the chief complaint and what's going on, she's having difficulty breathing, her sats are really low, I'm going to make her a priority patient. We're going to expedite transport. So now I'm going to continue with my history and the assessment. So, Kristen, what were you doing when this happened?
I was just playing outside.
Okay, and you were signed by a bee?
Yeah.
Did the difficulty breathing, did that come on suddenly, or was that gradual?
That's sudden.
Okay. And provocation, does anything make it easier to breathe? Are you able to do anything that helps?
Just when I lean forward, it helps a little bit.
A little bit easier?
Yeah, it just feels like my throat's closing up.
Okay, so as an EMT, that's a huge red flag. Feels like my throat's closing up. We need to intervene immediately. Let me ask you some questions. So quality, this is one of those weird ones. You kind of have to change this a little bit. It's, again, more designed for pain, specifically chest pain. But we can change a little bit. So, Kristen, is it hard to get air in, or is it hard to get air out, or both?
Both.
Okay. Region, I'm going to omit that. That doesn't seem to be, that's not really helpful, so I'm not going to ask that question. Severity, on a scale of 1 to 10, 10 being completely unable to breathe, how would you rate your difficulty breathing? how long has this been going on?
For about 10 minutes.
Okay. I think I know the answer, but are you allergic to anything?
Yes.
What are you allergic to?
I'm allergic to bees.
Okay. Are you allergic to any medications?
No.
Okay. Are you prescribed any medications?
Oh, I am prescribed on bees.
Okay. Is this your EpiPen? Can I
Yes.
take a look at that? Okay. Put it down. Has this happened to you before?
Yes.
Okay. When it happened before, this is another good question for anaphylaxis patients. When this happened before, what did they do for you at the hospital?
They gave me Benadryl and Epi.
Okay. So their answer can kind of dictate how serious this potentially could be. If they said, I don't know, they gave me a shot and I went home, or they intubated me and I was there for a month. It's a huge difference, right? What's the last thing you ate or drank today?
I had a sandwich.
Okay. And so just to clarify, you were playing in the park and you were stung by a bee. It's, rapid onset, you're having difficulty breathing. It's a 10 out of 10, is that correct? Okay. So at this point, I'm going to do a modified secondary assessment. I'm going to expose the patient's chest. I'm looking for hives, rash, redness, swelling, anything like that. What do I see?
See hives, rash to the chest, back, arms with accessory muscle piece.
Okay. I'm going to, there's no real diagnostic utility in palpating, so I'm going to omit that. I'm going to get lung sounds, really important. Second or third intercostal space, mid-clavicular line bilaterally. Fourth, fifth, or sixth intercostal space, mid-axillary line bilaterally, and subscapular bilaterally. What do I do here?
So you have expiratory releases in all fields.
Okay. And I want to get a baseline set of vital signs. What's her blood pressure?
It's 88 over 58.
Her heart rate?
122 strong and regular.
And her respirations on O2?
22 beats per minute labor with normal tidal volume.
Okay. So my field impression of this patient, she appears to be having an anaphylactic reaction to a bee sting. I'm going to treat this patient like an anaphylactic patient. She's prescribed an EpiPen. I'm going to assist her in the administration of it. Before I do that, is this your only EpiPen? Okay, so you haven't taken any prior to Miramar. Okay. That's not a contraindication. You can assist with one, even if they've taken, sometimes they have two, but it's just good to know. So, with that in mind, there are no contraindications for this medication. Per San Diego County protocol, I can assist with the administration one time only of the patient's own prescribed epinephrine pen. I'm going to remove, well first I'm going to ask the patient, are you right or left-handed?
Right.
You're right-handed, okay. So I'm going to go through my 5 rights. This is the right patient. I see her name here. It is EpiPen, right medication. The route is going to be intramuscular. It's going to be 0.3 milligrams for the dose, and it is not expired for the right date. So she indicated to me she's right-handed, so I'm going to place this in the patient's right hand. Give me your right hand. Okay, I'm going to remove the safety. I'm going to explain to the patient what we're going to do is we're going to stick this in your side of your leg here, okay? We're going to hold it for 10 seconds. On the count of 3, we're going to stick it in. It's going to poke, a little needle is going to come out, it's going to hurt a little bit, okay? So anticipating her pulling away, I'm going to assist her sticking, and I'm not going to let her pull the needle out. Ready? On the count of 3. 1, 2, 3. 1001, 1002. Time warp 10,000. I'm going to put this immediately into a sharps container. I can rub the site to help break up the medication, help it circulate a little bit. I'm going to then start my reassessment. I'm going to reassess her LOC, her GCS. How are you doing, Kristen?
Okay, a little better.
A little better. Can you hold up 2 fingers for me? So she has a GCS of 15, 4 for eyes because she's still tracking, 5 for verbal, she's responding appropriately, and 6 for motor. And I'm going to reassess her ABCs and her vitals every 5 minutes. You said you're feeling some relief with your breathing. It was a 10 before. What would you rate it at now?
It's about a 5.
About a 5. Cool. Okay. And now we're transporting to the hospital. I'm going to give a quick turn over to the receiving facility. Questions? Comments? Concerns? Complaints? Cool. Let's break up. Yes?
Do you have to do the field impression before the interventions? Or
Yes. Yes.
Okay.
A good way to look at the field impression is justification for what you're about to do. So all these patients, at least in the assessment, you're going to be intervening somehow with some medication, depending on what's wrong with the patient. So you have to justify why you're about to do what you're about to do. In the cardiac chest pain scenario, you have to say, I believe it's cardiac and here's why, as opposed to, a cough that they pull a muscle or something, because that can cause chest pain too, or they got punched in the chest, that can also cause chest pain. So you have to justify what you're doing. Also, yes, I'm going to leave it at that. Anything else? We still recording? Getting all this?
All of it.
So just go ahead and break up.